Hello, friends. My name is Dr. Nayyar Zakazmi. You're watching my YouTube channel, and in today's talk, I'm going to explain what is the S.I.R model of pandemic modeling. And in particular, I will try to make it as simple as possible and make you understand how the susceptibles, the infected, and the recovered segment of a population they interact with one another, and how, on the basis of this interaction, we can actually predict how a pandemic is going to behave in the future. So stay tuned and watch my next segment.
Okay, friends, so let's start. So, we will be talking about explaining the spread of an epidemic on the SIR model, where S stands for susceptibles, I stands for infectious, and R stands for recovered. So, recently we have been seeing that the number of cases as far as COVID-19 are on a constant increase, and the total number of cases as of today, that is the 25th of June 2020, is almost reaching 9.5 million people all across the globe. Now, this is quite a big number, and the question is that where would this pandemic it would level off? So, if I draw a rough graph, and you see that right, this was the start of COVID-19 pandemic, and we have seen that the number of cases have been rising, and we also know that at some point in time this would level off. So the question is that where would this level off? This is the big question, whether it's going to be level off at the level of the world population, which is 7.5 billion. So it's going to level off at 7.5 billion, or it's going to level off, let's say, 25% of the world population, which is usually around, I think, 2 billion. Or would it level off, let's say, at 100 million, which was the the number of affected people when Spanish flu hit? So these were the figures of Spanish flu back in 1918. So this is the question which is actually catching the attention of the epidemiologists and the mathematicians all over the world, that where would this would eventually level off. And by the leveling off, we means when at least 99% of the cases have occurred. So this is the big question. So the thing is that to understand this thing, we need to understand the compartment model. So the compartment model is the model which is also known as the SIR model, and in which we divide the population into three compartments, which are known as S, I, and R. So S stands for susceptible population, I stands for the infectious, and R stands for the recovered. So in case of a new infection like the novel coronavirus, where the population has never been exposed to this type of virus, so theoretically all the people, they are susceptible. So in other words, the whole 7.5 billion population of the world is the susceptible population. So let's say this is the population of the world which is all susceptible in case of COVID-19. Now, as the infection starts, so out of this 7.5 billion, you start getting the cases. So people, they would be subtracted from this group and they would go into this group, infectious. And if somebody becomes an infective case, he's no more susceptible, because he's at the moment carrying the infection, so he's no more susceptible. So over a period of time, people would be subtracted from the susceptible group as they become infected, and they would land in the infected group. So they would change the group from S to the I. Now, once somebody gets infected, so after some time, he would either recover or die from the infection. But for the sake of simplicity, we simply call it recovered, though recovered also means that they can die as well. So over a period of time, people who are infected, they would change the group from the infected, and they will move over to the R group. So somebody who has recovered, he is no more infective and he is no more susceptible, because theoretically, if he has got some antibodies, he is not that much prone to the infection, at least in the near future. Though some of the infections like common cold, and these are the exceptions, but we are talking about COVID-19. And in COVID-19, the research has shown that the disease cannot occur to an individual very soon after the somebody has been infected. Now, once people have recovered, so they would remain recovered, and I told you that this R actually means two things. They could be completely recovered, or they can also die. So deaths, or also because somebody dies, he is no more infectious. So what happens is that gradually over a period of time, people who are susceptible, they become infected, and once they become infected, they would recover. By recover, they mean they would either fully recover or they would die. So the number of susceptibles would gradually decrease over the period of time. So because the people are getting constantly subtracted from this group and they become infected. Similarly, the infected cases to begin with, in the beginning of this pandemic, the infectious cases would start because nobody is infectious, and as the number of people are increasing because of the exponential growth, so the number of cases or infective cases, it increases till a time comes when you will have the maximum cases, because at the same time as the number of cases are increasing, some of the people, they are also getting recovered or getting died, so they are being subtracted. So they are also getting, so this is a very dynamic group. So people are being added to this group, and at the same time they are being subtracted to this group. So in the beginning, more people are being added, less people are being subtracted. So what would happen, this would eventually, in the beginning, this would increase. A time would come when the number of people being added would be equal to number of people being subtracted. There it would reach a plateau, and after that the number of people who are being subtracted, that would increase as compared to the number of people who have who are getting the infection, and in that case the graph would come down. So if we draw this on an XY graph, and let's say we take the blue color for the susceptible. So from in the beginning everybody is susceptible. Let's say this is 100%. So in the beginning everybody is susceptible, but over a period of time the susceptible number of susceptible would come down. Similarly, to begin with, nobody has got the infection. As one person get infection and he transmit to the others, and the infection rises exponentially, so it will increase to a particular level, and after that it would go down. Similarly, as far as the recovered people are concerned, to begin with, nobody is recovered because nobody is infected, everybody is susceptible, but as people start getting infected, after some time they will start getting recovered. So if we draw this recovered line, so after some time you would see that people start getting recovered, and over a period of time recoveries increases. So this is the S, this is the I, and this is the R. So this is the mathematical relationship between these three compartments. So the S goes gradually, it goes down over a period of time. The infected, it increases rapidly, then it reaches plateau, and then it goes down. While the number of R, which is recovered plus death, it gradually increases over a period of time till it reaches a plateau. Now coming back to this S.I.R model, and let me draw it once again. This is the S compartment, this is the I compartment, and this is the R compartment. And again, these are over simplified compartments, because those who are susceptible, they would only become infected if they are exposed. So there would be some form of exposure here which would make them infected, and after infected they become either recovered, which means complete recovery, or death. Now the number of people gradually is getting subtracted from the S, and they are being added to the infectious group, and again from that they are being subtracted and being added to the R group. Now the rate at which people are getting subtracted from the S and being added to the R, again this can be quite fast, this can be quite slow. This rate of being added from this group to this group is known as beta. This is very important. You should not understand wherever beta comes in the SIR, it simply means the rate at which people get subtracted from the susceptible and get added to the infected group. So that is known as beta. Similarly, the number of people who get recovered or die after being infected, the rate at which they recover or die, that is denoted by what we call as gamma. So gamma means the rate at which people are being subtracted from the infected group to either get recovered or they die. Now, if we look at the COVID-19 situation, so as of today, let's say the total world population is 7.5 billion. Now, as of today, that is the 25th of June 2020, a total of 9.8 million people have been affected so far. It doesn't mean that at the moment there are 9.8 million people. This is the number of people who have been infected right from the beginning of this pandemic. So these have been the total number of cases. Of this 9.8 million, at the moment, those people who are currently infected, these are those people who are all over the world, and at the moment they are actively harboring the virus. They are 4 million. So we have got 4 million active cases as of today. So we have got 4 million active cases. Now, similarly, those people who have recovered and death, we know that as far as death is concerned, as of today, the total number of deaths, if I convert it into right figures, is 0.49 million. So right from the beginning of this pandemic up till date, 0.4 million people have died, while 5.3 million people have fully recovered. So far, of all those, the 9.8 million people who have been infected, 5.3 million people have been fully recovered. So these are the statistics as of today. Now, it simply means that if we subtract this 9.8 million from the susceptible, the rest of the people are susceptible. Now, the important thing is that we should also know that these figures, they are based on the actual testing which has been done. Now, it also depends on the testing capacity of the system. We know many countries which are actually poor countries or developing countries, they don't have that much robust system to test each and every individual. So usually not enough people are being tested in those countries, and that's why the number of positive rates can be low. But in my previous lecture, I told you that how we can calculate the actual number of cases from the mortality figure. So let's say if 0.49 million people have died as of today, total 0.49 million deaths, and these deaths, let's say on average the case fatality rate, global case fatality rate is around 1 to 2% case fatality rate. So let's say if 0.49 million people have died, and if they are, let's say, 2% of the total cases, then we can get the actual number of cases from this 0.49 million deaths. And from 0.49 million deaths would equal to 24.7 million cases. So this would be the actual number of cases. We know that at the moment the actual number of cases, reported cases, is 9.81 million, while so far the actual number of cases from the case fatality rate is around 24.7. So it simply means if you subtract 9.81 from 24.7, which would leave you with probably 14. So 14 million cases globally have been undetected, simply because either the people were asymptomatic or they were mildly symptomatic, or simply the system was not robust enough to test them. So this would be the number of cases. So again, going back to this thing, that if you look at the susceptible, individual and recovered, so number of people are constantly being subtracted as they are getting infected. They go into the eye compartment, and from the eye they go into the R by getting fully recovered, or they die. Now we can actually decrease this conversion from the S to the I group. We can actually inhibit it. In other words, we can reduce the beta, because this is actually what we want to do. We want to reduce the beta. Beta simply means that we want to keep the people in the susceptible people, and they should not become infected. And again, there are so many things that can be done to decrease the beta, that is the conversion from the S to the I group. So for example, decrease of beta can be done by social distancing, by lockdowns, by good hand hygiene, by strict border control, and by use of masks. So by this we can decrease the beta, which is the conversion from the susceptible to the infected. So we have to actually decrease this one. The other thing is, we can, if we go back over here, we can also increase the gamma. Gamma means that those people who are infected, we can increase their recovery. So theoretically we can increase gamma. Practically there are like sort of caveats over here. It's not easy to increase gamma, but let's say theoretically what can be done to increase gamma. So the principle to increase gamma is, if we have got good treatment, let's say we have got very good treatment, for example a novel antiviral drug which is very effective against COVID-19 virus, then we can increase the gamma. The other thing which gamma can increase, paradoxically, if people start dying. Again, if there are more deaths, obviously if somebody dies, he's no more infected, though he's no more living, but at the same more he was. So this is another thing by which the infective conversion from the infective to the recurrent group can be increased, though this is not desirable. You don't want to have more deaths, but again, by having more deaths, you basically your gamma would increase. Now ideally in any pandemic control, you want to increase the gamma and you want to decrease the beta. Now how you can do that, I have already explained it with the examples. Now important thing mathematically is that the ratio of the beta by gamma, this is known as the basic reproduction number, or not as well, and we always want to keep this ratio below 1. So ideally beta divided by gamma should be less than 1, and this would lead to then exponential decay. So over a period of time, then what would happen is that the cases would decrease till it reached down to a level where there would be no more problem. If it is equal to 1, then it would lead to a constant presence of the illness, and if it is greater than 1, then it would lead to exponential rise, which we are seeing at the moment, because the cases are gradually increasing. At the moment, I think every day 171,000 people are being added to this pool of people getting infected, and that is increasing day by day. So it's still exponential growth. So in other words, the beta divided by gamma is greater than 1. So if we want to decrease the ratio of the beta to the gamma, again we can either decrease beta or we can increase gamma. So at the moment, from the statistics, world statistics as of today, the beta, which is the rate of the people being subtracted from the susceptible and being added to the infectious group, the beta as of today stands at 0.05. This is of today, while the gamma, that is the conversion from the infected to the recovered or death group, that is equal to 0.036. So if we take the ratio of beta by gamma, which is equal to 0.045 divided by 0.036. This equals to approximately 1.2, which is still greater than 1, and that's why we are seeing an increase in the number of cases every day, and that's gradually increasing, and we are seeing an exponential curve worldwide, which is still going like this. So that means an exponential growth. Now with these figures going on, as long as the ratio of the beta to gamma would stay above 1, we would see an exponential growth, and the number of people who are infected would rise and rise. Now for some diseases, like if you look the 2003 SARS, that had a very high fatality rate of around probably 20% case fatality rate. Now there, the reason that it didn't spread, unlike COVID-19, was the reason that the gamma was very high. So in this case, the gamma was very high because there was very high case fatality rate. So gamma increases if you've got high case fatality rate, because the number of people who are getting subtracted from the infected to the recovered death group, that increases. So that's why even though the B was quite high, similarly the gamma was even much more high. So that's why, despite having a high case fatality rate, it eventually died out. So we didn't have more than 2,500 people all over the world, and that was the total number of cases with a very high fatality rate, and eventually it disappeared. So the reason was that the gamma was very high. If, let's say, in that case the case fatality rate was low and the incubation period was prolonged, probably it would have spread the same way as we are seeing in case of COVID-19. So to summarize it back, again, remember that the pandemic modeling explained because the population is divided into compartments, and in the beginning everybody is susceptible, then they become infected after being exposed, and after being infected for some time they either get recovered. In recovery, they mean they fully physically recover, or they eventually die. So the rate of transmission from S to the I, this is denoted as beta, while the rate of transmission from the I to R is gamma. So the principle of pandemic control is that we want to decrease the conversion of this group from S to I. So beta needs to be decreased, while at the same time we want to increase the people who are being affected to go into the full recovery compartment. So in other words, we want to increase R, but again, as I said, there is a caveat here. R can increase if the case fatality is also increased. If some more people are dying, so definitely people are not remaining infected, and that also increases that, but we don't want that. So remember, if we want to increase gamma, that should be the expense of full recovery by giving, let's say, a good ICU care or proper treatment, and that's we can recover them. While the decreasing the beta, as I told you, that we can do by good hand hygiene, by social distancing, by wearing of masks, by lockdowns, by closure of businesses, and there are so many things which different countries around the world have experimented with different results. So this is how the population is divided into S.I.R model, and that's how they go from one compartment to the other compartment. And at the same time, we have shown you how we can decrease the rate of transmission from one group to the other group. So remember, the ratio of the beta to gamma should be less than 1, and as I told you that these are some of the strategies by which we can bring it below 1, and eventually the pandemic can be controlled.
Okay, friends. So this was an overview of how the S.I.R model works. I have tried to explain it with very simple graphs with very simple explanation. And I hope you have understood how we can use this model to predict the outcomes in case of COVID or in case of any pandemic that you are confronted with. So if you have liked my lecture, do subscribe. And if you've got any question, just put it down in the comment section and I would love to answer your questions. Thank you very much.